Welcome to the 2022 DoRN Symposium series, Early Career Researcher Day. My name is Dhara Chauhan, and I'm a fourth-year student at the University of Toronto, currently assisting Dr. Kelly Holloway at the Canadian Blood Services on a qualitative narrative study on the experiences of immune globulin recipients and clinicians in the Canadian healthcare system. Today, I will be sharing the findings of a literature review on the experiences of immune globulin recipients and clinicians. Immune globulin is a plasma-derived product which was initially developed for the treatment of immune disorders, but its use has since expanded across various illnesses and conditions. The global demand for IG continues to increase as plasma donations continue to decrease worldwide. The COVID-19 pandemic has further exacerbated the global IG shortage as it has caused a significant decline in plasma donations and collections, negatively impacting the global IG supply. In recent years, Canada has been making efforts to increase its plasma self-sufficiency to ensure patients have a safe, secure, and reliable IG supply. The aim of this literature review is to explore the emerging literature on recipients and clinicians' experiences receiving, delivering, and administering IG therapies. Despite decades of increasing IG indications and global demand, literature in this area is only starting to emerge. There is a need for a conceptual classification of the constructs or themes in this research area to help generate new ideas or directions for the field. The search for articles took place between February 11th and March 24th of 2022. Articles were found from Google Scholar, HealthStar Ovid, PubMed, and ProQuest. Key search concepts of the search strategy include patients, IG or immune globulin, plasma-derived products, specific diseases that require IG treatment, specific medical specialty clinicians that prescribe and administer IG treatment, experience, sociology, and qualitative research. Only articles published in the 2000s and onwards were included. Most of the literature on IG clinicians is focused on communicating clinical guidelines of immune globulin use with different types of clinicians like nurses and pharmacists for administering IG therapies. It is important to note that these types of articles or forms of literature have been excluded from this literature review. A total of 14 articles have been included in this literature review. They come from the research areas of clinical immunology, neurological science, patient preference and adherence, as well as social studies. The empirical studies included in this literature review mainly sampled IG recipients from the US, France, Canada, Sweden, UK, and the Netherlands, but this literature review also includes multinational studies. One theme identified in the literature is the need for more patient information. In studies that measure IG recipients' experiences, recipients express the need for more information on their disease and the IG treatments available to them. This type of information is also known as patient information or patient education. Charid and colleagues, as well as Revol and colleagues, found that French recipients wanted to learn more about their medical condition and the IG treatment they were receiving. Surprisingly, only 25% of the IG recipients surveyed by Revol and colleagues knew that IG is a human plasma-derived product. The concepts of the burden of treatment and treatment satisfaction have emerged in this literature review. IG literature that examines recipients' preferences in different IG treatment settings or modalities often discusses the concepts of burden of treatment and/or treatment satisfaction. Reduced burden of treatment and improved treatment satisfaction are theorized to promote IG treatment adherence and subsequently improve health-related quality of life. One major theme identified in the literature is that of IG administration setting. Studies that aim to measure or compare recipient preferences for home-based versus hospital or clinic-based IG treatments. In studies that measure IG recipients on their preferred IG administration setting, most studies have found that the majority of patients prefer home-based treatment over IG treatments in hospitals or in clinics. IG recipients have provided many reasons for this preference, some of which include increased autonomy, lower healthcare system utilization, and easier integration of IG treatments into their lifestyle due to the characteristics of flexible scheduling, shorter duration of IG infusion, etc. These studies have been conducted with the aim of further understanding and improving IG treatments for recipients in order to improve their health-related quality of life or improve their treatment satisfaction. One major theme identified in the literature is that of IG administration modality. Intravenous IG versus subcutaneous IG. In studies that measure IG recipients' preference in different administration modalities, studies have noted a tendency to prefer subcutaneous IG for the benefits of greater autonomy and less intense side effects. However, IG recipients also tend to express their discontentment with the higher frequency of IG administration if it is administered subcutaneously, as well as technical difficulties. Studies also show a tendency to prefer intravenous IG or IVIG for less frequent IG administration and the reassuring presence of a healthcare professional during IG administration. In these studies, recipients have also expressed a dislike towards the intense peak trial effects following shortly after administration and the higher healthcare system utilization. These studies aim to measure or understand recipients' preferences in different administration modalities in order to help in the personalization of IG therapies for recipients. The final theme identified in the literature review is that of the biopolitics of plasma. Analytic sociological articles on plasma-derived products, like IG, describe how the development, delivery, and administration of plasma-derived products is socially mediated. For example, the risk assessment of blood or plasma donor groups and plasma-derived products is socially and politically relative. The development, delivery, and administration of some IG products, like anti-DIG, is gendered. Moreover, the political mobilization of patient groups following blood contamination events has resulted in the higher safety regulations for blood products and plasma products that we see today. Despite the prohibition of the commodification of blood and blood components, IG is a highly valued plasma product in the global market. In fact, plasma product manufacturers establish partnerships with patient groups to secure demand for their products in the market. This literature review also allows for the identification of some gaps in the literature available today. For example, there is a lack of research on the lived experiences of IG recipients and clinicians. Furthermore, there is a lack of research that discusses the sociodemographics of recipients and the role of intersectionality in shaping the lived experiences of IG recipients. There is also a lack of research done within the Canadian context or the Canadian healthcare system, especially since Canada is one of the highest per capita users of IG in the world. This literature review is part of a larger qualitative, multi-sided narrative study titled Liquid Gold: Exploring the Social Landscape of the Expanding Use of Immune Globulin in Canada, which will contribute to reducing the gaps identified in this review. This study aims to map the pathway of Ig products from blood or plasma donors to Ig recipients in the Canadian healthcare system, as well as to document Ig recipients' lived experiences of illness and treatment within social, cultural, familial, and institutional contexts, as well as documenting clinicians' practice experiences involving Ig products and interactions with Ig recipients. Here are the references. Thank you for listening.